Okay, good evening, everyone. I want to call the Tuesday, October 18th, Macon County Health Department Board meeting to order at 5:36. Carolyn, would you do roll call? No, I'm sorry. Don't want to take the job away from Susan. We did that last meeting, so kind of out of sync, just 24 hours ago, yes.
Mark Scranton.
Here.
Jeff Entler. Here. Candy Clevenger. Here. Carolyn Wagner. Here. Debbie Hill. Dr. Jerger. Dr. Meningati. Cody Parks.
Here.
Dr. Smith.
Yes.
And Dr. Snyder.
Yes.
Okay, please rise and join me in the pledge of allegiance. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, I'd like to get a motion to approve the agenda topics. So moved. Second.
Mark Scranton.
Yes.
Jeff Entler. Candy Clevenger.
Yes.
Carolyn Wagner.
Yes.
Cody Parks.
Yes.
Dr. Smith.
Yes.
Dr. Snyder.
Yes. Brandy, do we have any public comments at all?
No. And then we.
Okay. Okay, approval of previous meeting minutes from September 20th. Motion to approve.
A second.
Okay, roll call.
Mark Scranton.
Yes.
Jeff Entler.
Yes.
Candy Clevenger. Carolyn Wagner.
Yes.
Cody Parks.
Yes.
Dr. Smith.
Yes.
And Dr. Snyder.
Yes.
Okay, I'm going to delay the approval of the meeting minutes for the closed session to a little bit later in the meeting as we get down to closed session for specific reasons due to the nature of the closed session from last month. I have some copies of that I will share with the board for review before you take that action. So that's the reason I want to wait till we get further down the agenda. Okay, old business, review of the health board bylaws. I don't know if anybody's got any questions on that. Everybody's had a chance to look at that yet, where we're at on that at this point.
I'm still working on making a couple of suggestions in terms of bringing the bylaws into compliance. There's not really a lot that isn't what I would call compliant with statutory requirements. The primary one being the election of officers. There's a provision in the bylaws that says that elections, if they're contested, shall be by ballot, effectively a secret election, and that's not permitted by law. So that needs to change to reflect the fact that your votes have to be done on the record in an open session. Other than that, some of the changes I'm recommending are really just taking language that is copy and pasted out of statutory law and getting rid of it. I'm not a big fan of copying statutes into bylaws when the statutes could change and of course do control. So that's where I'm at right now. I'm probably about, well, if I'm looking at my notes here, I'm working through page 6 of 11. I don't think there's a lot more to be done, but I should have something that I can send out to the bylaws committee before the next before next month's meeting, and maybe have that ready for the board to consider.
Okay, so we have that next month, Mike?
I would imagine, given where I'm at currently, that shouldn't be a problem.
Okay, great, thanks. Anybody else got any questions for Mike or anything they want to bring up on that? Okay, review of the personnel manual. I know we tabled that last month. In light of our meeting from yesterday, I think that there were some things that were brought up. Mike, if I get too far off on this, let me know. But we had some discussion about some changes that we think that need to be made in regards to maybe some structure on some things that I think we were, all the personnel committee was in agreement that we need to work on with Brandy and try to update that stuff. And that's going to be important to add that to the personnel manual. So I don't really see much benefit of us really going through the rest of it right now until we got that stuff packaged together. And some of that I think is probably going to have to be ran by Mike or even perhaps even Ed, since it's personnel related.
Be the personnel committee that reviews it.
What's that?
Will be the personnel committee that reviews it with.
Yeah,
Brandy.
absolutely.
And we'll make
And then we'll just make the recommendations to the changes after we revisit all the legal aspects of it, if there is any, with that, with like I said, with Mike or Mr. Flynn. I think that would be good. We had a good conversation about making some changes in regards to some of the things that are in there now, and some things that need to be added. So I think we'll again follow up with that next month. I would like to try to get a consensus, if possible, for the personnel committee to meet either prior to next month's meeting, if we have the information by then. I know Brandy being gone for a couple weeks or so, that may slow that process down because she's got a lot to do between now and that time. So we'll just see where we end up at with that.
I
Okay.
have one quick question.
Yeah.
Okay. So Bethany and I have been talking about, and with you historically, about just coming up with new ideas, for staff and looking at new policies and things that we might want to implement just across the board. So we had thought about asking the whole board just for ideas on things that you would like for us to look at writing drafts on. Do you want me just to bring that to the personnel committee first when we talk about these other policies, or do you want me to talk about it tonight? What do you prefer?
Are these recruitment retention ideas or?
I would say most of them are, yes. Yeah, just trying to brainstorm and not even things that we feel sure would work or be feasible in our environment, but just want to kind of gauge the board's interest on us researching and drafting policy. Because we don't want to get too far into drafting or sending it to legal without, first seeing, where you are and just making sure we're all on the same page before we get really deep into it, and also seeing what ideas all of you have of what we could research policy wise. So I'm fine with doing it with the personnel committee, but if you'd rather have it with the full board.
I think if
do that.
you want to just give us a brief overview right now of what you're thinking, because it's interesting you should bring that up, because I have my own idea on a certain position that I've discussed with Kathy, and it's obviously going to be a work in progress for discussion, but I think timing wise, I think that might be a good thing, to be a benefit. And are you okay with me talking about that a little bit? So we have a vacancy right now in Kathy's team for somebody to oversee emergency preparedness.
Hey,
And
Mark, I want to say we now have 2 vacancies.
what's that?
We have 2 vacancies.
Okay, I was going to talk about that one specifically.
Okay.
So she has a vacancy for a food inspector because of somebody resigning. But the emergency preparedness position has a lot of facets to it for the benefit of the rest of the board to understand. And Kathy, feel free to jump in with some thoughts as well along the way. But I've had this in the back of my mind for a while because I'm on the EMA board also committee. And with my background, that's one reason I'm on that committee for that. There's a lot of things that cross-link, and there's things that EMA does that emergency preparedness doesn't do, and vice versa. I think we need to really have a much stronger presence with the individual we get for emergency preparedness. And so I was asking Kathy what her thoughts were on that. I would like to see us revisit the job description for that position and the responsibilities, because I think we could find some stronger individuals that have the background that would be more effective as a emergency preparedness coordinator versus somebody having split duties, which the way the thing is set up right now, they're wearing kind of like 2 hats. And the reason I think about that is because there's a lot of things that go on with emergency preparedness that I think could be more effectively shared in the community through some educational programs, maybe going out and just talking to people more about what emergency preparedness is. One of the programs I'm going to probably put in front of the board for consideration next month is some funding for a CERT program that used to exist here in Macon County. It had been grant funded. I'm a pretty strong advocate about having citizens, having been on a fire department for 14 years in Macon County. It's very, very hard to find volunteers, but when you got volunteers knocking on your door saying, what can I do to help? What can I do to help my community? That program doesn't have any funding. I'm going to look at what the costs are. Tammy's doing some research on it for me. And the other individual I'd asked to give me some data on that is no longer here to ask for some more details on that. So I've asked Kathy to maybe help me with some information for that so we can do a presentation to the board later on. But the CERT team is basically does a lot of different things, specifically when it relates to different kinds of disasters. If any of you ever been around dealing with working with a tornado or somebody's had a catastrophic, event, fires and things like that. We are not as strong as a community with the support that we once enjoyed with organizations like the Salvation Army and Red Cross. So there's a citizens group out there that was very involved in the past. There has been some formal training done. My understanding is there's even some resources, equipment-wise and things that we may or not still have. But they lost this whole program across the state. It wasn't just Macon County that lost this. So I think once we get some numbers on what the cost will be, and we're talking a few $1,000s, is my understanding, not very, very much money at all. I think it might be something we might be able to look at and say, this is something that warrants using some money out of the health fund perhaps to fund that. I think it would benefit the health department as well as the EMA to bring that program back. And part of that would be that the person that's doing emergency preparedness along with the EMA would be involved in helping to facilitate the training programs and stuff. I could tell you from personal experience, long before I ever got on fire department, I went through, many of you may remember Dave Friley, who's a great guy in this community. I can remember going down to the building on Lakeshore Drive and going in the basement, taking classes for damage assessment and a bunch of different things through the Red Cross programs and stuff. And we just don't have that resources available anymore. And I think bringing the CERT team back, having a group of citizens that make themselves available to help out with some things in the community when situations arise that needs there, I think would be very, very beneficial. And I think there's some people out there that are really interested in serving in some capacity. And I think that's a place where it might be a good fit for some people. So I see emergency preparedness being able to grow and develop. And by doing that, I think it will be a benefit to the community. And it'll allow Kathy to have the flexibility to hire some people that are dedicated for doing the environmental health side stuff without having to try to find somebody that has the qualifications to try to do both tasks, but allows a person to focus on emergency preparedness stuff specifically. And I think that may be something in the future we might look at.
So right now, we do have it posted as is. I think that she's already started some interviews, but there's been no offers or anything. So is there any way we could maybe get together and chat about that really soon?
Absolutely.
And then that way, if we change the job description, we could get that posting changed and start getting candidates then. So we just don't get too far down the path of current and just, because, I'm sure that Bethany or I and Kathy could get together with you and maybe talk through what that would look like.
Absolutely.
Okay, well, we'll just reach out to you if you're okay with that.
Yeah, we could set a time to do that. And then we'll talk more about the CERT program once we got some more information. But I did want to mention that for the benefit of the board. Okay, then what other thoughts did you have that you wanted to talk about on that, Brandy, as far as?
So again, I just want to preface this by saying these aren't things that we have drafted up in any way yet. We just wanted to see what your thoughts were. We don't even know if all of them would be feasible, whether that's financially or logistically implementing them. These are some things that have been asked for from employees. Some of them, several employees have asked about over the course of time. And then, some of them are just based on us doing some research, and then some are things that we've seen from employees exiting. So, I know one thing that we've already talked about is possible remote, positions or hybrid positions for those positions that can be. Is that something that the board would like us to look further into and maybe draft a policy to bring to you to look at or bring to the personnel committee?
I would like to look at it, and I'd also like to know who's doing it.
Okay.
Who else, what other health departments are doing it, and what kind of success and issues have they dealt with? You sort of did that during COVID. Did you have issues or concerns?
For the most part, I would say it was very successful. I think you're always gonna have some issues as you work through something, especially as it was so new for us. But I would say for the great majority, it was very successful, and especially considering we had no space to put all of those contact tracers. And right now we're running out of space for the current staff that we have as we have more programs and more staff that we're required to have under some of these grants. So either we're going to have to do something else space-wise, or we're going to have to really seriously look at, moving some of them to where maybe they're sharing a space and they're each working hybridly, or some people are just completely remote. But we can even, when we're asking other health departments their successes or their frustrations, we can also, of course, include the information from our perspective of what worked and what didn't, if that helps.
My biggest concern, I know everybody had to adapt during the time of COVID. A lot of businesses, offices, have closed or reduced their staff in-house and things like that. My biggest thing that I want to kind of keep the eye on the ball, so to speak, as you go forward with this idea of doing some of this, is that we have some mechanisms in there for accountability. Because I'll be honest with you, it's really hard to track what somebody's doing when they're not at work. And if they're getting tasks done that they're assigned to them, this guy here is going to spend 6 hours to do something that takes me 2. Something else that he does in 30 minutes, I might spend 2 days on. So, it's not that you're not doing your job and I'm not doing mine. We just all function at different rates on particular topics or whatever. And then it's like, okay, did I take the afternoon off? We need some kind of a way to track people's activities. I know if they're tied to a computer and they're doing computer work, they gotta be logged in. If they're not actively doing stuff on the keyboard, then at a certain time, they're gonna get bumped off or whatever. So, I don't know what you have currently in place. Obviously, you guys have been doing this for a while because that's what you guys were doing for the last year and a half or so. But going forward, I understand if you're looking at it from a space restriction, accessibility. The other thing to think about is we have a building here that we can't make it any bigger. So we're talking about we're down 15, 20 jobs potentially right now. So if you hire more people, and all of a sudden, where's everybody gonna go? Do you put some, dividers up in this room, for example, and turn it into some cubicle space? But then you wanna have a meeting, you have no place to have a meeting. So, those are things to think about, and I don't really have an issue with it as long as we think through some of the pitfalls that people could potentially take advantage of.
And I guess I have a question that kind of leads into this. This listing of the positions, both vacant and currently filled.
Yes.
I noticed you have 2 newly added positions under starting point.
Yes.
Were those added to satisfy grant requirement, or was it demonstrated need?
So they were added to satisfy grant requirement. And then there was one program that we have that needed another person, so the caseloads fit within the required amount per care coordinator. And so then they finally gave us funding to be able to pay for that extra person. But yes, those were funding.
And then the follow-up question to that is, are we to assume that all of these positions are driven by grant requirements? I guess what I'm trying to get at is, how long have some of these vacancies been there? Are we in danger of losing grants because of that? Or conversely, has our utilization rates gone down that maybe some of these positions could just be given to attrition?
So it kind of depends on the position and the department or the different divisions in the health department and the position specifically. So a lot of our programs in general, but especially the positions we have are grant driven, just because historically we had to have the grant money in order to have the position. Some of them, you probably noticed over the course of time have had more turnover. And so there's been, a revolving door of people coming through some of these positions, but when they don't stay, of course, it has that negative impact of losing the knowledge, additional training time. A lot of them, because they are driven by grant deliverables, we still have to meet the requirement of the grant deliverables when we go to report for that grant in order to be compliant. So we usually have situations where peers or supervisors are covering the load for that position while it's open in order to still meet those grant deliverables. If we don't meet grant deliverables, some of the grants will continue to fund you or maybe just decrease your funding based on what you've done over the course of time. But we definitely could run the risk of losing funding if we aren't meeting deliverables. So we try everything that we can to fill that coverage, and that was, one of the things I definitely wanted to speak with you about tonight. But then we also don't want to burn out the people that are here and not reflect that somehow, that they are doing more than the job that they were hired for. Because we do have, just as one example, in the WIC section, the last section, you'll see where it says competent professional authority, CPA. That's one of those I've referenced before that's very, very difficult to hire for because the qualifications required by the grant are very, very strict.
What does this person do? What does that position do?
They are, Karen, would you be willing to speak to that so you give specifics for
The
us?
CPA is the nutritionist for the WIC program. They provide the certification visits and assessments for clients enrolled in WIC.
Dietitians?
They have to be a dietitian or have a degree in nutrition,
Okay,
and they can be a registered nurse as well.
okay, with no additional education other than what you get in nursing.
Correct.
And I would be more than happy, if the board all together sometime, tonight or anytime, or just if any of you on, one-on-one basis wanted to kind of go through some of these positions to hear more specifics. I have no problem going through that because you probably saw my board report, I feel like we're in crisis staffing situation. I think it's gonna get worse. And if we can be more creative or if we can, figure out other ways to ensure these positions are covered but not lose other staff or burning them out, then I'm definitely very open to, any assistance the board can provide with moving that forward.
So what you're saying tonight is that all of these positions are required based on your current utilization. None of them should be given over to attrition.
No, I do not believe so. I will say, statewide, but including in Macon County, some of the WIC caseload has been down, but that's across the entire state. So the state's very aware of that, and trying to work through that to get more people to utilize WIC. So that could be something, eventually that the state says, we're not gonna give as much funding because of utilization, or something of that nature. And then I would say to you, hey, we're just not getting enough WIC clients, so we don't need to get this position. But I would say as of right now, yes, at least as we're moving into a world where we do want more people to use WIC and we do hope more people start utilizing it, we would need the staff. And again, with their requirement for very specific credentials, I'd rather be in front of it than behind, but those positions are pretty much never fully staffed through any year just because they're so hard to get.
Were there other ideas?
Anything else,
Oh,
Randy?
yeah, sorry. Another one that comes up a lot is paid parental leave. So after someone would either have a baby or adopt a baby, having some number of weeks to, be home, take care of the child. We did present this in the past, but it didn't pass. So we do already have draft for that. And this is one that comes up from staff a lot. And so I'm definitely interested in, moving that forward if we can, but I wanted to see if you all are even interested.
Wouldn't that need to be a countywide,
So not all of our I give you history and then Mike might want to weigh in too, but that was part of why we were told no before, was just because it can, cause difficulty. We have a policy that the rest of the county doesn't. All of our policies don't directly mirror the county's policies, so we do have some things that the rest of the county doesn't have, and like our vacation schedule works a little bit different than the county handbook does. So I'll let Meg weigh in on the legal side of that, but I do feel like if we're trying to be more progressive and kind of clear in the county, especially for something like maternal and child health, which is, an area that is a top priority for health department, that this would be something we want to support for our staff, certainly. And then maybe the rest of the county would want to catch on to. Did you have anything you want to say? Anything to weigh in legally?
Not particularly. My role is obviously not to make policy recommendations, to advise on whether something is a good idea or a bad idea. I simply would advise the board that you have the authority to adopt personnel practices that are not necessarily consistent with those personnel practices in force in other departments within the county. But at the same time, the board should be aware that any personnel practices that it adopts could have some impact. Whether that's a good or bad impact is a different area to be considered, but it could have some impact on the practices of other offices within the county. So particularly with departments where we have collective bargaining agreements, if you have personnel practices that are quite a bit more generous adopted at the Board of Health with respect to the health department employees, then the county may find itself in a difficult position when it's time to negotiate collective bargaining agreements with employees of other offices where they are seeking similar treatment. Again, that is not said in order to persuade or dissuade the board from taking any action, pursuing any course of conduct, just to advise you that those are considerations that are properly considered by the board before deciding on something like that.
Another alternative, and I don't want to get too deep in this because it's going to go to the personnel committee, but another alternative could be short-term disability insurance. I mean, that's what we had at HSHS.
The county does have that.
Okay, so that could be used for maternal leave.
And people do use it. Most situations, it's around that 2-week mark and it's about 2/3 of their pay. So not everyone can afford to take it. So that's why we were looking to try, to do more if we possibly could.
So you would maybe think of augmenting that amount instead of just completely paying it out of the funding, but utilize the short-term disability and perhaps boost it?
Well, for the first 30 days of your, parental leave, you can't even get that short-term disability. You have to use benefit time or go on unpaid time. So, something even just a little bit, to help in that time period to get people through to where they can use that. Because if that doesn't kick in, some people can't even afford to get to that 31st day taking off work.
The parental leave issue was right in the beginning of my entering the county board, and there was some pretty strong opposition to it, but I will throw up a little bit of a message flag and see what the thoughts would be, and try to see what kind of support there would be to come back this way, so that we don't waste a lot of time with something that's gonna get squashed, pushed out quick.
So what do you get now?
So we don't get anything now. There's short-term disability.
Yeah,
We don't
that's
have
it.
to pay.
That's my last question.
But if you have time, you can take that as well.
Yes.
Yeah.
So you do get.
And you can use your
Yeah, you have
flex
your
time.
benefit time, yes.
Yeah.
Okay, can we keep going?
Yeah.
Another one, and this might be a similar issue, childcare reimbursement is one we've been asked about several times. Okay.
You have it set up so that you can include that with your Well, benefits here, you could, how you save it and put it aside, so you
Oh, yeah.
get tax-free dollars.
Spending account. the spending
Wait
account.
just a second.
Hello,
Hello.
there's water if you want.
Here,
Brandon.
this one? Sure, go for it.
Okay, another one is, tuition reimbursement for people who are wanting to continue their education in their roles. Again, another one we've been asked about a lot, and I know
The
we've talked a
county
little
does
bit.
not have anything.
Yeah,
I definitely think that's,
Yeah, in regards to that, as long as it's specifically tied to their
Yeah,
job or
yeah.
their job
what
growth
they want to move
potential
into, yeah.
to move up.
Yeah.
Yeah, I could see that being a plus, because better take somebody that worked for you and train them
Right.
to move them up than it is to try to find somebody you don't know what you're buying.
I agree with that.
and we do have, a system put in place for non-required or, certain types of training where people do have to sign an agreement. If they leave within a certain amount of time and having to pay a portion back, so that's something we can include in there for you all. Another one, gym membership stipend. That's been talked about for years, so that's fine.
Obviously, based, so it's limited, they get reimbursed for it.
Yeah, I mean, however, if we could make it happen, we would make it happen. We've done, we've worked with the county very closely in the past about doing like discount and setting up agreements with different, gyms or centers in town so that they can have a discount, but, we've been asked about the possibility of doing some kind of stipend to promote wellness and then also give them a little bit more of a benefit that they.
See, that seems like a really good idea, because that's extremely reasonable.
A lot of companies have gone to that for wellness because it ends up saving them money in the long run. I think you got room here, you grab a couple of treadmills, a couple of stair climbers, put them here in the room all there, aside.
We tried in the past,
We'll
it's
get
liability.
a board there, and Marissa Kathy can get here talking, have their computers in front of them, and they just multitask. I can see it now.
I can barely walk up my stairs at home.
Like all that stuff, not at all.
Don't want those extra ones.
Okay, so we'll look at some stuff on that, and then another one,
And I think, real quick, Brandy, I think that's a really good idea, because I know, like, I personally don't go because I live on the wrong side of town. Everybody always opens everything on the north side of town. We gotta figure out how to stop doing it, because everybody lives on the south side of town, visits all the best restaurants. I know people that are going to Planet Fitness, they talk about what a great place that is, for example, and they got a massive amount of equipment in there.
And it's like $10 a month.
Yeah, it's cheap. You're not gonna do that if you live in Mount Zion. I mean, it's just not convenient. But, I mean, I can see that could be a real plus too, so.
The childcare thing you was talking about, you hear some of these places offering like in-house, I know that sounds weird, but I
I
think
know,
some
we
of them
tried to
offering
do that
in-house.
years ago,
Yeah,
yeah,
a
we
little bit
talked.
more.
And we're at, a disadvantage space-wise, but I would love to do that. That and like the workout center we talked about years ago is, pitching ideas when we were in this We Choose Health project of what can we do to promote wellness internally, and then we were partnering with area business to help them with employee wellness.
Yeah.
And it didn't go anywhere, but if it could go somewhere now, then I would be thrilled.
The daycare item is fraught with hurdles.
Yeah.
I was on a daycare board, and all kinds of restrictions and regulations, requirements.
A lot of liability.
And it's hard to keep it even in the black, if you're trying to use that as a benefit. I could shed a lot of insight on that.
Well, and then the last one that I have, other than asking your ideas too, would be increasing bonuses. Right now, the only people that get a sign-on bonus here are nurses that come in. It's $1,000 and it's paid in 3 installments. So they don't get it for a while unless they're staying here, but when you're looking at, I saw one the other day at Springfield Clinic and it was, I think, $15,000 to $40,000. You see them being $10,000, and obviously we can't do that much, but can we do more, and can we maybe do other staff that would come in and then do some kind of agreement, like you don't immediately get it and then you can't just leave, but I don't know if that would work or if we would be able to get that cleared through legal, but just an idea as we're trying to think of anything.
I would also like to look at retention
Oh, yeah,
bonuses,
100%.
because we were able to do a little bit of that at Chick, not a lot. I think we only did it once, but it was based, when we had some extra money, it was based on years of service, and people were given a one-time bonus. This was not their annual evaluation. It was clearly stated to them, this is in appreciation of your longevity.
I think we've gotten, as a society, especially after what's happened the last couple of years, now it's gotten even progressively worse. My concern is, I even hear it from my own people, because I don't do it, and other businesses around, the attitude that existing employees get is, I've been here through all this crap. I've been busting my butt, I show up for work, I don't call in sick, I don't come in late, and now you're gonna hand an incentive to somebody walking out the street that you know nothing about, and they come in and you say, okay, if you're here for 3 months, you're gonna get $500. And 6 months down the road, the person's gone. Now, yeah, it's a risk you take, but for the person's been with you for a while, and I'm talking, more than a year or more, it leaves a real bad resentment. And I think a lot of employers are starting to kind of back off of that. I mean, I've seen some things. I mean, AgriFab, for example, has got a big sign out there, Mountain Sign. They're giving $50 gift cards to give people $50 gas allowance every week. Well, yeah, because you're taking people out of Macon County and incentivizing them to drive to Sullivan. So here, we'll give you $50 for gas. I mean, I had a guy working for me, he left, and he's now driving to Rural King Neptune, and I'm like, why? You're spending so much money beside your time on the road, and you're not making any more money. People are gonna make their own choices, but that's the danger in doing that. I don't have an issue with it per se, especially if it's tied to a stipulation, you have to work here for a certain period of time, and they don't get all of it at once. One thing that we started doing at work that's actually worked really good too is current employees. I did this about 4 months ago. I got them all together, and this is the way you bring in your people that are already here. I said, anybody that brings in somebody for a job, and they actually refer them, not just, hey, my buddy so-and-so, actually brings the person to the table and says, this is the person that I can speak well of, that I can tell you that's reliable, that I think would be a real asset. If they stay 90 days, I give the employee $500. The new hire doesn't get anything, but I give them $500 for referral. And so far, since we started that since the beginning of the year, I've had 2 people do it. It's not a huge amount, but it does help create a little bit better attitude with the current employees about, hey, I know somebody that's working that might be interested in coming here, because they like what we're doing and they want to be part of the team. I think those types of things may be actually more beneficial as you're trying to find people to fill spots. And that kind of achieves the same thing, but you're not enticing new hires. So that's something to think about too.
Yeah, I like that idea, and we have been asking staff to get their, contacts to apply, and we have had some really great referrals, so I think that's a great idea. And yes, I completely agree, retention bonuses, if we're gonna do something more with recruitment, it's definitely always a priority to make sure your current staff are showing that appreciation in all ways possible, so. Any other ideas that you want us to look into?
I thought of one that I'm not sure that we had on our list, but we do get this quite a bit by staff, if they go back to get another degree or a master's degree or something, if they'll get any increase in pay.
So that was that at Chick as well too, and at that time, that wasn't, unless it moved them into a higher position, that was required, that degree. But yeah, it's definitely something to look at. I would be interested, because I'm on the personnel committee, I'd like to see copies of your exit interviews for maybe like the last 2 calendar years. So that I can look through and see too, and then the committee can see what those issues were.
If there's kind of
A pattern, yeah, right, exactly.
Yeah, that might be helpful to understand that.
That's
Okay.
a great idea.
Anything else, Randy? On
No,
that?
I don't have any other ones.
Okay,
Thank you.
so moving on, review, discussion, action if needed on flex time, what's pay policy? I don't think we've really got anything concrete on that we want to do, other than we got information right now about the current status of hours.
I'd make a motion to table it for a while.
I'd like to see at some point maybe, and we could make the president's discretion, we could form an ad hoc committee. I'd like to see maybe one or, and I'm thinking about creating a quasi committee here to look at this. And I could see involving somebody from the personnel committee. I'm saying somebody, it could be one or two people, somebody from personnel, somebody from finance, because I think the two things kind of get tied together. And I'm not volunteering myself or anybody else, but a couple of us are serving on both committees already. Three of us that are sitting here. So I'm not saying that it has to be those people, so that's why it could be, you know, some kind of a fresh set of eyes. So that might be something I might think about. Maybe we put an ad hoc committee together from 3 to 4 people and kind of dive into that.
Maybe the volunteers people.
Yeah, so maybe that's something we look at. So we could get everybody thinking about that, if it's something they're interested in being involved with, and then maybe we can pursue that next month. Try to get that going. Okay, I think that'd be good. Okay.
Motion to table.
I got it. I made a motion to table it till next month.
Yeah.
Do you have a second?
Mark Stratton,
Yes.
Jeff Hitler,
Yes.
Candy Clevenger,
Yes.
Carolyn Wagner,
Yes.
Dr. Turger,
Yes.
Cody Parks,
Yes.
Dr. Smith,
Yes.
and Dr. Snyder.
Yes.
Okay, presentation, discussion, and action on current levy and options for use of the Health Department Fund Reserve by Macon County Treasurer John Jackson. I will be substituting for Mr. Jackson tonight because he couldn't be here. But we talked earlier today, and I know he had spoken to Mr. Baggett as well, as what our options would be. And I'm happy to report back that I think Mr. Jackson's come up with something that I think is very practical. It ensures the integrity of the Health Reserve Fund for now. And he has the latitude to do this, whether we want to give him the blessing to do it or not. I think on purpose, the board support this. He's already done with some other departments in the county already. He can take the health fund as it currently exists and move that 100% over into a money market account right now. We can get about 2% on that money currently, which is pretty good, without zero risk. And he can do up to 6 transactions a month. We could take out a little bit at a time each month. We could pull the plug on the whole thing and move the money back, whatever we want to do. But right now, that money's not earning us anything. So I think that would be great that we consider that, because that way at least gets the money moved for the time being to where it starts gaining some interest, and then we can discuss some other options down the road. I know a couple of the other departments of the county have taken some of their money, they've chose to go into some CDs. I'm not personally a big fan of CDs for different reasons, because it normally locks the money up for a specific period of time. If we have a situation that demands some money immediately, you're just gonna lose everything you're gaining this thing. If you're into a CD for 2 years and it's a year and, 6 months and 9 months, and you gotta pull that money out, you're gonna lose pretty much everything you gain by doing that. I do not like having my money tied down. I like to keep it liquid. This money market account, it's just a stroke of the pen to take it out of the account where it's at right now, move to the money market account. Would require, I don't know, would it require board action to approve that, Mike?
Absolutely not. The health fund is a component of the county's general fund. It's restricted. Can only be used for health department purposes. And it is subject to the general control of the Board of Health with respect to expenditures. However, the treasurer alone is empowered by statute with the authority to invest it so long as it's in compliance with the public, I'm going to get the acronym wrong, or the name of the statute wrong, but it's Public Finance Investment Act, I believe, PFIA. So the treasurer has statutory authority to invest the county's general fund money pursuant to the conditions laid out in that statute. Beyond that, he can invest it or deposit it with certain institutions at the discretion direction of the county board. But other than that provision where the county board can tell him where to deposit the money in terms of investing it, he is empowered by the statute with the discretion and authority to do so. He doesn't need the permission or consent of this board to do it. I know I've spoken to the treasurer personally about this. I don't think he would mind having the consent or the request of the board to do something, but he doesn't need it as a part of his legal authority to do so.
I understand that, but in the spirit of teamwork and good interaction between our respective positions, I think it would be good for the board. Is that something we can do tonight, or would it have to be put on the agenda that we're just gonna make a recommendation?
The way I'm reading the agenda, there is the potential for action on options for the use of the Health Department Health Fund Reserve. So the fact that it's listed on the agenda as contemplating potential final action, I think puts it within the, propriety for you to take action if you feel appropriate.
Should the motion contain specificity in regards to what he does with the money in terms of investment instrument right now?
If you have that, I guess, language prepared to reduce to some, specific request. I don't know what your discussions with the treasurer have been in terms of giving him direction on specifically how the Board of Health would want it to be invested. But if you have that ready, then absolutely, I think you could do that.
Well, I have the conversation I had with him.
Sure.
Because he said that's in its simplicity to do that and then move forward with diving into some deeper options down the road.
Mhm.
But there's no reason to wait, because every day that goes by, we have that money sitting there and it's not doing us any good at all. So I propose to make a motion that we give the treasurer the ability to take the money that's currently in the health fund reserve and move it to a money market account.
Second motion.
Any discussion?
I just have a question. How frequently do you need to dip into that for paying the bills? I mean, more than 6 times a month? Is there?
Oh, no, I don't.
I didn't think so,
No.
but I just, okay.
He watches, the treasurer watches that very frequently. They're looking at it on a daily basis. They watch revenue coming in, expenditures going out, because they're getting all the money flows through there with property tax payments are made and all that stuff. So he's got his eyes on the ball, I can tell you.
And there's no
Where the money's at.
penalty
No.
as long as you stay within those 6
No.
times?
Limited 6 transactions a month, that was the only stipulation, because it's a money market account. It's no different than what you and I would do if we went to the bank and said, hey, I want to have a savings account that's paying 2%. You've always got access to your money.
Right.
They don't want you to turn it into a checking account where you're constantly taking money out, and putting money in. There's costs associated with that. Any other questions or discussion? Anybody? Okay. Susan, roll call.
Mark Scranton,
Yes.
Sorry, Mr. President, who
Yes, sir.
seconded that? I'm sorry, thank you.
Jeff Entler,
Yes.
Candy Clevenger,
Yes.
Carolyn Wagner,
Yes.
Dr. Durger,
Yes.
Cody Parks,
Yes.
Dr. Smith,
Yes.
and Dr. Snyder.
Yes.
Okay, next item, discussion and action on staff mask. We visited this last month, and I think if I remember correctly, Rachel said there might be some things coming down the pipeline on some difference in guidance from CDC or something. So has anything changed on that right now?
There was an update to the executive order, and it did just align with the CDC guidance. So basically stating that whatever the CDC guidance is, the executive order is going to follow suit with that. So it did kind of eliminate the across the board masking for that. I don't know if you have any more specifics that you wanted to say on that, Brandy, I'll let you go ahead.
So, aside from, not looking at every single legal, entity to which we are subject, what I would say for the executive order is my understanding is, your healthcare areas, for sure, they should be masked. So anywhere we have to have that PPE, whether it's clinical or our dental clinic, for sure have to be masked. It does recommend still that if we're in high transmission, that everybody would be masked. And then as a reminder, if somebody has COVID and they come back during the period of time they can come back to work, they should be masked, which I had kind of mentioned, just concerned about if an employee is upset about anybody knowing they have COVID by them having to wear a mask. So we in administration have kind of been looking at different options of how we could look at every little caveat of who should wear a mask and doing what types of visits or what types of functions in the building, and then who visitor-wise should be required to wear a mask. So I don't know if you all are okay with us taking that and making edits with staff as we see fit, and then of course letting staff know this is subject to go back to full masking if we're in high transmission levels. If you're okay with us doing that, I think Bethany and I feel pretty confident to do that. And then Mike, I don't know if you have been able to look at all of the enforcement, everything that we're subject to. I wouldn't say I worry about that necessarily. I just want to be very cognizant of it. We have been the whole time. I don't necessarily think anyone's coming after the Macon County Health Department. But after talking to my colleagues at other health departments, many of them are still completely masked. And then the other group of them, they're masking in clinical areas. If they're doing, administrative functions, or maybe in a hallway that's not in a clinical area, they may not require masks there. It's kind of a split of the two, but everywhere is requiring masks, at least in some parts of their building.
So do you want the board to give you direction to implement a policy to make some adjustments, or do you want us to tell you that this is what you need to do, or do you want to review this and develop a policy? I want to see something in writing. I don't want to just say, you gotta wear a mask, you don't have to wear a mask. You gotta wear a mask on Monday, Wednesday, Friday, but Tuesday and Thursday you don't have to. I want to see some structure in it, and I think it needs to be tied specifically. That's why I looked before in the personnel manual about risk exposures, even though I know COVID's not listed in there, but it does give you a baseline to follow about, I'm working in an office, I'm behind glass, I'm only interacting maybe with the fellow employees. If you feel like you want to wear a mask, that makes you comfortable. I totally respect that and appreciate individuals' decisions to take those steps. In other areas, it's more specific because of interaction with clients and that type of thing. So you kind of have to figure out how to separate that, but I think it needs to be clearly spelled out because this could come back to be a problem. You talk about, I think Marissa talked about, I think a little bit last month, if you're doing stuff here versus if you're going out in the field and you're going to people's homes, that to me, for example, would be a clear indication that that should be part of that policy, that when you're out in the field visiting people, Kathy may say, I'm okay with my inspectors going to a restaurant and interacting with kitchen help and business owners or whatever. So there may be some things that maybe you could take away from the supervisors and directors so they can maybe help integrate that plan and those policies and have something that's cohesive, not just for one size fits all. And I'm okay myself. I'm okay with you guys bringing something back to us next month. I mean, I hate to kick the can down the road, but I think from what you're saying, I think you need some time to look at that and come up with something that everybody's comfortable with.
Well,
sorry. No, I was just gonna say, so we have been working on that for the
Okay.
last couple of months, and I mean, I have, and I know that, we can, if the board wants to be involved with it and, or review and approve the policy, but kind of just some things that we already had jotted down, it's still required in the following areas or situations. If someone tests positive for COVID, symptomatic, COVID-like symptoms possibly, that one could be shifted, some of these could be shifted, but in clinic settings when patients are present, so examples would be our vaccination clinics, STI clinics, WIC family family case management, in-person visits, visits to long-term care facilities, stuff like that.
Bethany, let me interrupt you real quick. So what we're just talking about, that's what you got on paper?
Yes, we already have it.
So are you to a point where you're good with that, or do you still want to develop that further?
I feel pretty good about it.
I feel good about it
There's
too.
some areas that, you know,
So-
are a little,
Let's
You
move
know,
on,
I'm
if you're okay with it, let's move on to some other things. If you could have somebody go burn some copies of that, pass it back around for us to look at, I got no problem coming back to this yet tonight, and we could approve that.
Have it formalized like that.
I mean, I just kind of have things jotted down, but I mean, it's fine.
Well, we're also, I know the board before, you know, on some things had said, you know, you could shift it back to our discretion just to get out. Every time we've done anything with the masking, with the quarantine isolation for staff, they do always get that in writing. It is always explained, you know, as clearly as possible, but given in writing, and then they are always allowed to come ask us questions. So if you would trust us to go ahead and make these changes based on risk exposure, then we would put it out in writing. And in that way, if something, you know, did happen and we went into high transmission and we said, okay, now everybody has to wear one, that we can make those shifts as we have, you know, throughout the pandemic. And you don't have to, like, we don't have to wait for another board meeting to
No,
make that change.
I guess you misunderstood what I was saying. I'm saying if you guys, we were sitting there just talking about putting a plan together, if you guys already have a plan, I think to support what you guys are wanting to do, we can look at that and say, yeah, this looks great,
I got it, okay.
go forth.
Yeah, because I think we're at the time where we are ready, you know, to make some shifts,
Yeah.
for sure. We just want to make sure we're not gonna, you know, get in trouble with some, you know, oversight agency, or that we're not putting anybody in unnecessary risk.
So what are you thinking? Will that let half of the building not have to wear masks? A quarter? Any ideas? I'm just
It's
curious.
gonna be, oh, sorry, I was just gonna say, it's gonna be hard because they might, even if they're in one position, they might not have to wear it this part of the day, but they might have to wear it a different part of the day.
Or different parts of the
Yeah,
building?
depending on what they're doing.
Well, like Marissa's talking about before,
Yeah.
if you're in the office working, don't need to wear it. I gotta go out and see somebody in their home, now I gotta wear it. If you have those provisions put into that policy, then I say, we're gonna go along with what you guys have developed. I'm not trying
Especially
to,
now that the governor has changed.
yeah, I'm not trying to change what you're doing. I just want to
Oh, I didn't
support what
think
you're
so.
gonna
Okay,
do.
that sounds good. Yeah, I just wanted you all to know, like, we feel comfortable doing it. We just knew since the board did bring it up and since we had asked, you know, about any possible legal ramifications, we were trying to be thorough, but I think we do feel ready to make some shifts.
The governor did mention in his second order that CMS still holds. You don't have to make it.
Yes, I
It
mean,
sounds
it's,
like you took care of it.
yes, I'm included in the, like clinical settings. And then, the other piece of that, I know I mentioned a starting point, that's one area that I feel people will have to mask a little bit more just because they are going into clients' homes who are, you know, older or, you know, compromised, but, sometimes things aren't super obvious or common sense to all employees, so I think we've probably been very, very detailed throughout. You still miss things and people have questions, but we make ourselves very available if they do. So we'll try to think of every scenario and throw all the examples into that communication, but we're certainly open if staff have any other questions.
Okay, well, while she's doing that, we're going to move on to new business. Macon County Board resolution for approving increase in appropriations in the FY '22 health fund budget for CCU workforce retention. All these three grants we're gonna look at, I pretty much had the same questions. I know Carolyn called me and asked me if I understood what some of these things were, because you had put into the language about what each one of these grants were, about money, where it was gonna go. And I guess one of the things I was trying to understand, because she asked about it, and I was like, so is this for grants that currently exist?
Yeah.
So what are we actually doing here with these, approving these then?
So these particular resolutions, if there's a change to the budget during the budget year after the budget's already been approved, then you have to do a resolution. So our budget last year was approved, you know, by the board in September and then went to the county board for approval in November. So if we find out about funding anytime during the year, we do have to do a resolution. It goes through our Board of Health and then through BHW Finance and then the full county board. The other times that you might see resolutions, just as an example, is if we got some brand new kind of contract with a brand new vendor or something, we usually go through legal to have them review that and then send that through resolution if needed. But a lot of the times when you see a resolution, it will be linked to any kind of change in the budget throughout the budget year. So if there was new funding that was given, if there's an increase in funding that was given during the year, if there was an extension on a date through which funding can be spent and/or the date that you can complete your deliverables, those would all be some examples of why you see resolutions throughout the year. And these are all linked to the money coming in and then just basically being spent.
So these are all things that are currently in process.
We probably had, in the past year, probably 3 or 4 of these prior.
With different grants.
Yeah,
I couldn't say a definite number, but yes, definitely
Yeah,
several, because this will
we've seen
happen, yeah,
we've seen them.
through the year. If there are those changes, we've had.
For the prior year,
situations-
I think I've seen them.
Yeah, we usually have them every year, because another thing that will happen is, like IDPH, thank you, is one example. And, they might notify us of a grant or an increase in grant funding after we've already applied for a grant. There might be another health department that's not spending all of their money, so they offer it to us, do we want the money? So that somebody's spending it, it's not being wasted from the state, and so in that situation, we may do a resolution to show we're getting more money, here's what we're spending it on. And then you can see, it does go through all those steps of the oversight until it's finalized at the full county board meeting.
Does these resolutions impact the budget since we've already passed it adversely, or what impact does this have on the budget?
If I could address that, I mean, the whole point of the resolutions, the mid-year resolutions, you can't lawfully spend money that hasn't been appropriated by the county board. So anytime you have an increase in funding and a necessary expenditure as a result of that increase in funding, it does affect the budget. It shouldn't affect it in a negative way.
Right.
But you can't spend more money than has been already appropriated by the county board. So if the federal government or the state government decides, because they're so generous that halfway through the year, they want to give you an extra $1 million, you can't spend a dime of that $1 million unless it's already appropriated for in your budget. So if you have already spent all the money up to that point that was appropriated by the county board during your fiscal year, you can't touch that $1 million even though it's sitting there waiting for you until you've been given permission. The county board has to appropriate it. So she's, because the Board of Health works in a unique fashion in respect to the county board, it has to go to the Board of Health first. And then you make a recommendation whether to agree to accept the grant and increase your budget, and then you ask the county board to increase your budget to give her the permission, the authority to spend the money that's been granted. If you have a diminishment in your budget, there is no necessity to go through the resolution process. The only time you have an obligation to amend your budget mid-year is when there is an increase in appropriations, an increase in spending.
So the simple way to look at it is probably just money in and money out.
That should be the only time it ever happens. And in fact, to amend a budget mid-year, the law requires that it be an emergency situation. Now, emergency is not defined by statute, but oftentimes you find language in the appropriating resolution that indicates that in the absence of an amendment, a mid-year amendment, you will lose this opportunity to expend some grant dollars or donation or whatever, and therefore you would have to spend county general money or health fund money, health reserve money, if you wanted to do the same activities.
I mean, these are revenue coming in, expenses going out,
Yep.
it's zero bottom line.
But without the county board telling you you can spend it, you can't lawfully spend it.
Right. Okay, anybody else got any questions on that? Okay, roll call on that resolution.
We do these separately.
We do 3
Yep. You got it.
Yeah.
different ones.
Okay. So do we have a motion, or we can just take the roll call?
Yeah, one motion.
I'll
Mark
take a
just
motion.
made. Second.
Yeah.
Okay, who first?
Aye.
Okay, thank you, on all three of them.
Yeah,
Sure.
if I can,
I'll
yes.
second all three.
Okay, thank you.
I think we have to,
The county board has some restrictions on when they're allowed to vote en masse. I don't think the same restrictions apply to you because you're not the final approving authority with respect to the appropriation. So you can vote on all of these at once if that's the desire of the board. If any member wants to vote on them separately, then that would be the appropriate way to do it.
anybody having concerns on that? Okay,
So you can do them together?
yes,
Okay, Mark Stratton,
yes.
Jeff Enders, Candy Clevenger,
Yes.
Carolyn Wagner,
Yes.
Dr. Jurger,
Yes.
Cody Parks,
Yes.
Dr. Smith,
Yes.
and Dr. Snyder.
Yes. Okay, so we'll back up real quick for a second here. We got these printed off, what we talked about on the proposed max changes. Everybody's take a moment to look at that. And like I said, I'm okay, we're not wanting to tell you how to do it, we just want to support what you're doing. And when you make your final draft of this, my thing would be that I would put some language in there that you're going to make modifications when necessary, however you want to word that. And then be able to give the staff some kind of a timeline that, you know, we're telling you that we're doing this change and it's gonna take effect on such date or in 7 days or whatever, that you think's appropriate. I don't want somebody who takes a long weekend to come in on Monday morning and find out they gotta do something completely different that they didn't know about when they left work on Thursday. So posting of any changes that might be made. I don't know that we necessarily have to take action on this, other than just saying we'll support what you guys want to do. Yes, Dr. Smith.
Just in looking at this, and under that first paragraph where it's masks are still required in the following areas, when it says symptomatic, I would just be a little bit more specific. I would come up with some criteria like a temperature, something like that, but, you know, you don't want to say a runny nose, you know, because there's so many allergies around here, especially this time of year with all the harvesting going on.
Believe me.
But, you know, I just think you need to outline and be more specific on what is a COVID-like symptom. You know, because what it is for one is certainly not what it is for another. It's very vague.
And you can define that and use that kind of catch-all provision, including but not limited to. So, you know, some discretion can be exercised appropriately.
Some people, a fever is 99, other people, it's 101.5, right, Jerry?
Yeah, we can definitely.
Yeah. I sweated.
So I don't think we need to make a motion or anything. We'll just tell you we support what you're doing. Glad to see this. I think you'll make the staff, some of them happy and some of them will not change. Okay, so, under another thing, new business. So, I know it's not on the agenda, but what we talked about yesterday, Brandy, Brandy and Carolyn, I'm looking at you two. We all talk about, are you okay with bringing up what we talked about for the staff? Just to kind of hit the pulse of the board?
Oh, correct, yes.
So, Madam Secretary had a genius idea, because we're talking about trying to do things to kind of lift people up as we come out of the stuff that's gone on the last 2 years. So I'm going to invite my fellow board members to be hosts and hostesses for a holiday event to serve a lunch or dinner, yet to be determined. We're going to work out the logistics of that. But I would like for us as a board to serve our staff for a holiday lunch or dinner. I'm on the board of the Lincoln Square Theater. I've offered that facility for us to host this. I think it would be a lot of fun. I think it would be great for spirit morale, interaction with us as board members, getting to know some of the people within the department. We pitched the idea to Brandy and Bethany yesterday, and they were enthusiastic, I guess, is what I'm looking for about the idea. So I just let you know, we're gonna probably work on that with some plans and probably bring that to the board next month with a date and stuff. But I would like to get our board members involved in hosting that event and being the drink pourers, the servers, the bus boys, whatever might be necessary to make sure that the staff of the health department has a enjoyable experience. And I think it would be a real team builder for everybody. We talked about it. We thought it'd be a great thing to do in the spirit of the holidays and everything else. And so we're letting the rest of you know that we would like to do that. And we hope that we get 100% participation from the board. So I just want to put that out there, but we'll send some updates out as we get forward, get a date settled down and everything as far as the time and everything goes.
Thank you.
Yeah. So, okay, board education, communicable disease updates.
Just a few things. Happy to report for COVID, we are in low community level, and for the first time in quite some time, we went down to a substantial community transmission at that healthcare level. So I was definitely happy to see that. Nothing new to report for NPV or NPX or monkeypox in that area. We have been working some other communicable disease cases as we always do every month. We've had some extra things going on with that, and staff have been very diligent on taking the extra time and putting in the extra hours to make sure those things are addressed right away to try to control spread. So very, very grateful to the team for that. The other couple of things I just wanted to touch on in board education are just a reminder, the board packet will go out next month, one day early due to that Friday being a holiday. So that'll be November 10th instead of the 11th.
Okay.
Anything you want me to add, just make sure you get that to us. And then the other thing is, I just wanted to kind of put out there is, I know when you all came on the board, I know we have a lot of new people. I did offer for you to come in and meet with me just to talk through different projects we had going on, and really anything, and get a tour of the building. I just wanted to re-extend that offer and just say that it's a standing offer. If there are any of you that do want to have more one-on-one time or talk through logistics, operations, staffing, or just kind of keep building that, teamwork approach as far as, getting as much information as you can possibly have since you're having to make a lot of decisions, I'm more than happy to do that. And so just let me know if you'd like to do that, or if you want a standing time each month, or if you just want to contact me as needed. You all have my cell phone number and email, so please just let me know. I want to make sure you have everything from us that you need to make these decisions every month. So those are the only things I have on the board of education. Thank you.
Okay.
Can I ask one question?
Yeah.
What is the definition for Decatur to meet criteria for low community level?
So there are, you want me to read them off to you? It's all done by the CDC COVID tracker.
Okay.
So the community level is what's kind of dictates if people are following the guidance, how you would behave out in just any type of setting. So if you should wear a mask, where you should wear a mask, basically what extra safety criteria you should follow. The community transmission level is what guides the healthcare facilities and what they're supposed to be doing out in the community. So there are several different criteria as far as how many cases, percentages of positive, I'm trying to think of what else, case rate, that all kind of get figured into that, and it's all done by CDC. And we switched to using CDC numbers and putting those out to the public if they want that information to guide their decisions quite some time ago now, just because that was what was starting to be used as the consistent measure throughout the nation. So I can bring it up and tell you what all of them are if you want me to. Or send it to you via email?
Yeah, send it to me.
Okay, I can do that.
I'm curious. We don't need to spend too much time now on this.
Well, that criteria has changed, as I'm sure you know, throughout the pandemic of what makes up the determination of where you're at. So, yeah, I can send that to you for sure. Any other questions for me, board education wise?
Just a comment on the hospitals, even though Decatur is considered a low community risk, because Springfield is not yet. That's the only reason they're still wearing masks at Decatur Memorial is because they're still considered to, since they're connected legally.
Yeah, we did reach out, well, not.
Connected by
Rachel
40
did.
miles?
Yeah, yeah.
To see what the hospital is
It's
doing.
a legal issue,
Oh, my gosh.
so, yeah, it's kind of silly, but we can be low, but we still have to comply with what the Springfield area is doing.
Okay, presentation and acceptance of the financial report is Sharice.
Sharice is unable to be here tonight,
Okay.
so I am covering her.
Didn't see her, that's why I was wondering.
No, she was not able to be here, but she got everything prepared for me, so. With the financial report, as of September 30th, we were 83% into the fiscal year. It reflects the ending fund balance being $7.8 million, and she sent a reminder that that is subject to year-end adjustments and not a completely accurate number. So you will see some change in that. Our reports are currently showing $1.6 million as accounts receivable, which is money due to the health department, which is not accurate. Sheree is working with the auditor's office to get that adjusted and corrected. Complications occurred with the switch to the new accounting software. So you will see some fluctuation in that, and she just wanted you to understand the explanation of why. And then total revenue, it shows at the $7.1 million, which is 102% of budgeted revenue. Total expense shows $5.6 million, which is 79.9% of budgeted expenditures. And then those figures will also change with the addition of the budget changes from the resolution this evening.
Okay,
I have a question in the emergency preparedness. It looks, as I'm reading this, that department is way over budget. Am I looking at that correctly?
Let me find out from her what that is reflecting and why it works that way,
Yeah.
and she or I
yeah,
can
'cause
follow
that's
up with you.
huge.
Yeah, and then conversely,
Mhm.
I'm looking at, I'm guessing this is probably the environmental fines and fees. When you look at that, they're down like only 52.9%. So I guess my question was, do we just, I mean, is that because of better compliance? Is that because we just don't have the number of places needing inspections? I was just curious. I was just wondering.
I can definitely find that out specifically, from her, if you're okay with that, and then she or I can follow up with you, if that's okay?
Yeah.
All right, perfect.
Any other questions? Make a motion to approve the financial report as presented.
Second.
Roll call,
Mark Scranton,
yes.
Jeff Emmett.
Yes.
Andy Clevenger. Carolyn Wagner.
Yes.
Dr. Jerger.
Yes.
Cody Park.
Yes.
Jeffrey Smith.
Yes.
Dr. Snyder.
Yes. Okay, review and approval of department expenditures. Anybody got any questions on any of this? Okay, hearing none, make a motion to approve as presented. Roll call,
Mark Scranton,
yes.
Jeff Emmett.
Yes.
Andy Clevenger. Carolyn Wagner.
Yes.
Dr. Jerger.
Yes.
Cody Park.
Yes.
Dr. Smith.
Yes.
Dr. Snyder.
Yes. Okay, grant applications for review and approval, I don't see any in here, so don't have any, okay. Department division reports, we didn't get a chance to do this last month, so we have, okay, all right. So she'll give us a presentation on starting point.
Hello, my name is Teresa Smith and I am the director of starting point here at the health department. So I've been here with the health department about 20 years. I started as a care coordinator in 2002. And then did some time as care coordinator, did some money management, moved on to care coordinator supervisor. I think 2014 became the assistant director, and then just in January of this year became the director of Starting Point. So we have 17 staff members in Starting Point. To be specific, I don't know how well you guys know about Starting Point, it's the senior services division. So most of our services are geared towards seniors in Macon County, so older adults 60 years and older. Okay. We have 17 staff members in our division. However, we only have 15 currently. We have 3 open positions, 1 in the process of being filled. We have myself as a director, an assistant director, a money management advisor, care coordinator, supervisor. Then we have 8 care coordinators, 2 senior information specialists, 2 caregiver advisors, 1 billing clerk, and 1 support staff. So that's all the people that kind of made up in our division. We serve as the care coordination unit for the state of Illinois Department on Aging. And we also serve as an aging and disability resource center for the area agency on aging, and that's out of Bloomington. So as a care coordination unit, we are contracted with IEOH to provide fee-for-service. So what we do, we provide 3 basic needs for the Macon County. We complete comprehensive needs assessments in the community for residents that are 60 years and older. We determine eligibility for our community care program in Macon County. And we complete choices for care or dawn screenings. And that is basically anybody who is looking at skilled nursing facility in Macon County. Any age, any person who might be considering going into skilled nursing facility has to have a choices for care dawn screening completed, and that's by state of Illinois law. So each of these are fee for contract. So if we complete the service, we're paid by IDOA for those services. We complete about 417 initial needs assessments for the community care program each year. In our community care program, we have 1,070 clients. So our community care program, there are income and asset limits. Actually, income does not matter in most cases, but you have to have less than $17,500 in assets to be a community care program member. Anybody in the area, anybody in Macon County can have a complete case assessment done regardless of their assets. So you could have $200,000 in assets and still not know what resources are available in our community. And we have a lot of resources available for seniors. So we'll still go out and we'll do the assessment and we'll look at all the needs you may have, do a complete assessment, let that person know these are the resources you are able to pay privately for. This is the things that you can do to help keep your loved one in your home or keep yourself home as long as possible. If you're eligible for the community care program, we actually go out, the state of Illinois will pay for home care aid, somebody who can go in and help that senior with the cooking, the cleaning, bathing, getting to the grocery store, preparing meals, getting to the doctor's office, all these things. They can put that in place. They can put in place an emergency home response system. So that's kind of the lifeline, I fall and I can't get up button. They can put that in place, and they can also put in place a money management program. All these things can be put in place by the state of Illinois, paid for by the state of Illinois. So we have 7 care coordinators who each carry about a caseload of 150 clients for our community care program. Okay. So every month they will call each of those clients. Every month a phone call. Every 6 months they go out and see them for a monitoring visit. Every year they go out and complete that comprehensive assessment again. So in fiscal year 22, we completed 1,118 of those assessments. So we keep pretty busy out in the community. As far as the choices for care dawn screening, that's the people who are going or looking at going to a nursing facility. State of Illinois states that they have to be eligible for that facility. So they're basically trying to make sure that people are not being forced into a nursing facility, number one, before they truly need that level of care. And they also need to know what their options might be to go home, and what their options might be if they don't want to go to the nursing facility. So we completed 1,559 of those last fiscal year. We have 1 care coordinator who goes out. Usually they're completed in the hospitals. Usually it's part of a discharge planning. You've fallen, you've broken your hip. You're going to have to go to the nursing facility short-term for rehab. Or you might just be to the point where you're no longer able to safely stay home and you need to go to a nursing facility for long-term placement. That's usually a conversation that's had by the doctor, the patient, and the discharge planner. We come in and just make sure that it is according to state law. So that's good. And then we have a money management program that is under the state of Illinois. 2 different levels to the money management program. Some people might just be having difficulty seeing their bank statements, having difficulty writing out their checks. They still retain control of their own accounts, but they need somebody to come out and help them. We have a program that can assist with that. We also have a little bit more stringent level of representative payee control, where somebody might need, usually it's for some reason involving, maybe they've had a long history of substance abuse. Maybe they've been homeless, they've been evicted, they have all these different we're contacted by Social Security Administration, and they request that we become representative payee for these clients. So their Social Security checks actually come to the Macon County Health Department. We take care of paying all of their bills. And then each week they come into the Macon County Health Department and pick up a weekly allowance. That's what they use for food, that's what they use for, whatever needs they have. So that is a program that we run. We have about 33 clients in that program. It's totally funded through either state of Illinois, or it can be funded through Adult Protective Services if they have an open case, or they can pay privately. We can have anybody age 18 or over, if they want to pay privately for these services, we will provide those services. And we have an insurance policy that totally covers, it's through Travelers, that covers any sort of situations that could arise with that program. So it's fully insured and bonded, okay? So that's the programs that are funded through the state of Illinois. We also have a bunch of grant programs, and I think that somebody actually had a question about one of them, our caregiver advisor and our senior information specialist. We've had an increase in that grant funding, therefore we're increasing the staffing, and we have to do that to match the grant funding. So we have a caregiver advisor program. Anybody in Macon County who provides care to somebody who's 60 years or older, or provides care to a grandchild. And so if the caregiver is 55 years or older, it's called grandparents raising grandchildren, but it can be any sort of family connection. We can provide in-person counseling, we provide group counseling. We have some very limited funding. We've had grandparents who all of a sudden have 3 grandchildren dropped off at their doorstep and they are not financially prepared for it. Maybe we can help them with getting food, getting them prepared, getting them, the children, their uniforms for school, whatever it might be. So we have those programs. We have a diabetes self-management program, which basically is a 60s class. It teaches people who have diabetes or somebody who's caring for somebody who has diabetes how to care for their disease, trying to prevent disease-related hospitalizations or illnesses. We have Stress Busters class, which is designed for seniors who are providing care to help them manage their own stress, and so that they're able to take care of themselves so they can provide care for others. So everything we do is geared at either providing the senior or the caregiver of that senior support so that they're able to stay healthy and in the community for as long as possible. So that's kind of a highlight of some of, we have many other smaller grants. If you ever have any questions, if you ever want to stop by and visit, I'm always available. Tell you in depth more, but for now I think that everybody's probably ready to be done with the evening, so I will, unless you guys have any questions, I thank you for your time and for your support.
Teresa, thanks.
Thank you.
Thanks for all you do.
Okay. Employee recognition, we have some anniversaries this month, October is in your packet, and thank those for their service.
Yeah.
Yeah, big ones. A long time.
Thank you.
Karen is here, yeah.
Okay. Make a motion, we go into closed session pursuant to section 2.C.21 of the Meetings Act. And pursuant to section 2.C.1 of the Open Meetings Act. For the purpose of employment, compensation, discipline, performance, or dismissal of specific employees of the public body.
As well as to review closed meeting minutes. Mr.
Yes, thank you
President.
for that. Okay, no motion to go into closed session. First. Roll call.
Cody Park,
Yes.
Jeff Etler,
Yes.
Mark Stratton,
Yes.
Dr. Jordan,
Yes.
Candy Clevenger, Dr. Snyder,
Yes.
and Dr. Smith.
Yes.
And Carolyn, name yourself also.
Myself, Carolyn White.
Okay,
Mr. President, the other two items, there was a question put to the board as to whether to allow the administrator to roll over a certain number of sick days, I believe not to exceed 6 is the understanding, if they're still available before she utilizes any other time post November 1st. So if there is a motion to that effect.
What's that?
did you say sick days?
I'm sorry, vacation. I'm
Vacation days,
sorry.
okay, I was
I'm
gonna
sorry.
say, thought we talked about vacation days.
I make a motion.
Second.
Brandy, you okay with that?
Yeah, I'll do it.
Since we
before
discussed it then, I'll make sure we're still clear on where we're headed with that, okay?
Do you wanna put something in writing to, so that I can confirm that I did have that permission, or is this enough?
The minutes will
It's
be,
on the
will be
record. I
sufficient.
think we're okay, aren't we? Okay,
Roll call, Cody,
Yes.
Jeff Etler,
Yes.
Mark Stratton,
yes,
Dr. Jordan,
Yes.
Candy Clevenger, Dr. Snyder,
Yes.
Dr. Smith,
Yes.
and Carolyn White.
okay, last item we have is approval of the closed session minutes from meeting September 20th. Need a motion and a second.
Motion.
Okay.
Motion to approve.
And this is the
Jeff.
minutes.
Closed session minutes from last
Okay,
month.
okay. All right.
Here you go.
Cody Park, Jeff Etler,
Yes.
Mark Stratton,
Yes.
Dr. Jordan,
Yes.
Carolyn Wagner, yes. Candy Clevenger, Dr. Snyder.
Yes.
Dr. Smith.
Yes.
Okay, any other discussion? On anything? Motion adjourned. No.
Members, I will collect